think it's recording. Hi, everyone. My name is Pilar Bonilla, and I am here to present on my dissertation on loving kindness ABA, analyzing the effects of meditation on implicit bias in ABA staff. So we're going to go through our agenda today. We're going to start with our background information, discuss some previous research. I'll discuss the purpose and methods of the current dissertation study, as well as our procedures. We'll analyze some results together, and then we'll move into our closing discussion. Starting with our background information. So at present, the largest racial and ethnic group in the United States is white, accounting for more than 50% of the nation's entire population. And this is per Colby and Orton in 2015. Now, decades of research have indicated that systemic white racism has been embedded into American society so that the whites are benefiting the most from the system, while people of color are oppressed. And this systemic white racism has really spread into the healthcare system. And it poses a pretty serious US public health problem. Now, Mather and Rodriguez in 2021 explained how clients receiving ABA services are regularly experiencing the effects of systemic racism via biases in the healthcare system, particularly BIPOC individuals. BIPOC meaning Black, Indigenous, and people of color. Many of us know that it is recommended that BCBAs receive training and continuing education on how to work with people from diverse backgrounds and support clients as best as possible. However, cultural awareness training is really not enough to make an impactful change due to something called implicit bias. So let's talk about implicit bias. Implicit biases are these unconscious biases that we learn through repeated personal experiences and cultural socialization. And this was per Burgess et al. In 2016. Now, Payne and Vuitic in 2018 explain how these mental associations can really lead to unintentional discrimination. And these biases, or these implicit biases rather, are outside of our own awareness, making them very difficult to control, which then leads to significant issues in healthcare, contributing to inequalities in providing services, per Burgess et al. In 2016. However, not all hope is lost. There is really fascinating new research emerging that is analyzing the effects of mindful meditation on clinicians and implicit bias towards patients. Let's talk about that a little bit. Starting with what meditation is. Many of you may have heard of meditation, some of you may have not. So I want to give a little bit of background into meditation. So meditation, as explained by Budaya in 2017, is a specific technique that is used for resting the mind and attaining this transcendental state of consciousness. And he explains that the word meditatum comes from the root meditatum. Meditation comes from the Latin root meditatum, which means to ponder. Now, there are countless different types of meditation. We've got moving meditations, such as yoga, Tai Chi. We also have breathing meditations, mantra meditations. I mean, there are just countless different types. And one type of meditation is targeting this self-regulation of a sentimental state of unconditional kindness towards yourself as well as others. And this is known by Stell and Farsides in 2016 as loving kindness meditation. And recent research in meditations suggests that mindful individuals are demonstrating a decreased automatic bias and a decreased strong negative emotional reactions. And this is per Luke and Gibson in 2016. So let's dive a little bit into some of this previous research. Now, Kong et al. In 2014, who you're going to see on the top of the slide, and Stell and Farsides in 2016, you're going to see on the bottom of the slide, are very similar studies. They are both analyzing the effects of loving kindness meditation on their participants using the implicit association test, or the IAT, as their dependent variable. Now, keep in mind, both of these studies used group designs. So starting with Kong et al. In 2014, their results, demonstrated that implicit bias against the target population of Black and homeless people decreased in the loving kindness meditation group in comparison to a control group and a simple loving kindness discussion group. Now, for Stell and Farsight in 2016, the results were really demonstrating that a brief 7-minute loving kindness meditation directed towards different racial groups reduced implicit bias for participants in the treatment group more obviously than the control group. However, something I want to point out is that one of the limitations for both of these studies is the group design. In ABA, group data do not represent real behavioral processes. And Sidman in 1960 explains how the use of these separate groups really destroys the continuity of cause and effect that characterizes an irreversible behavioral process. So as of date, this topic has actually never been researched within our own behavior analytic discipline, which poses a pretty serious limitation in the literature, especially when allied research is demonstrating that implicit bias in healthcare workers is affecting patient care, per Burgess et al. In 2016. So as a result, the purpose of the current study is to really analyze the effectiveness of a brief loving kindness meditation on implicit bias with ABA staff using a single subject research design. So now we're going to dive a bit into our methods. So we have 3 participants for this study, 2 of which are BCBAs, and 1 is a registered behavior technician. The setting was virtual because these participants were all at various locations. So the setting for the sessions took place on the computer, which leads us into our materials. In addition to a computer, loving kindness meditation scripts were implemented, as well as, of course, our dependent measures. Let's talk about our dependent measures a bit. Starting at the very top, we have our IRAP. The IRAP is the Implicit Relational Assessment Procedure, and it is a computer program. And what it is measuring is the participant's latency to responding to stimuli presented on their screen. I'm going to show you an example of what this looks like in the next slide. So just stick with me for one more moment. Our next dependent variable may look very familiar. This is the implicit association test. This is the exact same dependent variable that was used for Kong et al. In 2014 and Stell and Farsight in 2016 in their studies. Now, there are a lot of different categories you can do for the implicit association test. You can take this online anytime if you would like to as well. And for this study, the race category was used. Very similar to the IRAP, this is also measuring participants' response latency. The next dependent variable was the Promoting Cultural Diversity and Cultural Competency Self-Assessment Checklist, also known as the PCDCC. There are 36 items on this questionnaire, and this is essentially measuring culturally competent practice. Now, the final dependent variable was the Mindful Attention Awareness Scale, or the MAS. This is actually a 15-item questionnaire, and it's really measuring the core characteristics of mindfulness and awareness. So as promised, I was going to show you this picture on the slide. Now, I like to show this picture because it depicts a little bit of what's kind of going on with the participants when we are in the middle of this research study and what the testing looks like. So particularly when the participants are taking the computer program portions of the dependent variable, they're going to have images pop up on the screen, and they use their keyboard to determine an association as quickly as possible. So hypothetically, if a participant had a much longer response latency trying to associate white with bad and black with good, like you see here on the left side of the screen, but then they had a much faster response latency when they were switched to associating black with bad and white with good, this would demonstrate racial bias against Blacks. So moving into our procedures, a multiple baseline design across participants was used with 1 baseline and 1 intervention condition. Now, for both baseline and intervention conditions, session duration was about 5 to 10 minutes. The frequency of sessions was about 3 days a week, and the most significant difference really between these conditions was the session topic. So for baseline, the session topic was a simple client check-in. These one-to-one meetings are required for the BACB for supervisees. So meetings like this are really, really common. And in baseline, we discussed client updates, successes, barriers. And then when we moved into the intervention condition, the session topic changed to be the loving kindness meditation instead. I am a certified meditation and mindfulness teacher. And so I would lead the participants through the loving kindness meditation exercise, and modified scripts from the International Mindfulness and Meditation Alliance, or the IMMA, were used. I thought it would also be really important for a topic such as this to assess social validity. So social validity was measured across all participants at the conclusion of the study. You'll see it is a 6-item questionnaire. I have an example of what it looks like on the left side of the screen. And I don't have enough space to show you this, but at the bottom of the social validity form, there was a space for open-ended comments as well. Moving into our results, best part. Now, something I want to remind everyone before we completely dive into the results is that these are all hypothetical. This study has not concluded yet. And as many of us probably know, hypothetical results tend to look the most beautiful. So hopefully our results look this good, but these are all fake results. So let's start with our IRAP results. Again, this is measuring the response latency to responding to stimuli on a computer screen. So at the bottom of the screen, or rather our x-axis for each of the participants, you're going to see the session number. And along the y-axis for each of the participants, you're going to see the response latency as measured in milliseconds. Now, what you're going to see across all 3 participants was what much longer response latency in baseline. And then there was a significant decrease after exposure to the meditation intervention across all 3 participants. The next results that we have are our IAT results, the implicit association test results. Now, participant results and descriptive statistics were used for this condition, well, for both baseline and loving kindness meditation conditions. So again, these results are hypothetical, but what you'll see is there is implicit bias towards or against both different categories of races associated with the test. So you'll see participant 1, participant 2, and participant 3 have their results split into 2 categories, one for Black people and one for white people. Ideally, what we would like to see in our results section is that there is statistically significant difference between baseline and the loving kindness meditation conditions. Moving into our PCDCC results, keeping in mind this is a questionnaire that was posed. One thing that is important to know before I go into describing the graph is that this was conducting using probes. One of the things I was a little concerned about with the study was exposing the participants repeatedly to a lot of the cultural competency questions, as I was fearing some testing, impacts. So this was done using probes. There were 3 probes in baseline and 3 probes during the meditation intervention condition. So along our x-axis, we have our number of probes. Along our y-axis, we have our score. The highest possible score to receive on this is 36. What you'll see across both, all participant 1, participant 2, and participant 3's results is there were much higher scores of B's and C's during the baseline condition, and then much significantly higher scores in A in the meditation intervention condition. So when participants are provided with the PCDCC, they can respond to a question using A, B, or C. Scores with mostly C's depict much lower levels of culturally competent practice, and scores with mostly A's depict higher levels of culturally competent practice. So what we'll see is that after exposure to the meditation intervention, that culturally competent practice self-reported by the participants did increase. Finally, we have our mass results. Along our x-axis, we have our sessions, and along our y-axis, we have our scores. The highest possible score to receive on the mass is a 90. And again, although these are hypothetical, they are beautifully significant differences between baseline and the meditation intervention condition. So for participant 1, 2, and 3, the results after exposure to the meditation intervention condition did increase in comparison to baseline. Moving into our discussion, the results of the study really indicate that the brief loving kindness meditation was effective in reducing implicit bias across all participants. And so results also demonstrated that mindful awareness and attention also increased. And these results really align with previous research, particularly the group design research depicting the potential benefits of loving kindness meditation on decreasing implicit bias. Now, this study also expands the current literature on equity, diversity, and inclusion in the field of behavior analysis by providing new research on implicit bias in ABA staff. So while the results of the study point to a possible solution to reducing implicit bias in ABA healthcare, really so much more research is needed to replicate these findings and conduct even extensions of this study as well. So even looking at repeated studies within the range of ABA staff would provide much more information on cultural humility practices within the discipline, as well as how to continue to improve the quality of care to families. And in order to make interventions such as these much more accessible to the employees, future research could also investigate loving kindness meditation in group settings and the bliss point even for duration of meditation to reduce implicit bias. There is a wave of reform happening in our field right now. And it turns out when making an impact, a little loving kindness can go a long way. Thank you so much.